So in today's session, we'll discuss about some gastrointestinal diseases. What are they actually? What causes them? And what small treatments are available? Treatment options are available from a dietetic point of view, nutrition point of view, as well as some surgical and pharmacological point of view. Medical management will not be taught. We'll just give you the options, what is available. Okay. In detail about these dietary management, in detail about the dietary management and nutritional management, we will be discussing in our dietetics classes. Okay. So starting with the session, gastrointestinal diseases, your digestive system is made up of the entire GI tract, which starts from your mouth and it ends at your anus. That's the entire GI tract, gastrointestinal tract. Okay. Along with that, other organs like liver, pancreas, gallbladder, okay, they are also the part of your digestive system. They help the body to digest food. Digestion is important for breaking down food into nutrients. That is your metabolism, basic metabolism, which your body uses for energy, that from macronutrients, proteins, carbohydrates, fats, growth, cell repair. Some digestive diseases and conditions are acute, which are short term. Okay. Diseases are acute, which are short term, and others are long lasting, chronic. Okay. There are two main types of digestive disorders: functional and structural. These topics, whatever we are discussing right now, the presentation we are discussing right now is not available in your textbook. It is just an additional class just to give you a brief about the healthcare aspect from a healthcare point of view. What are diseases? So coming to what are functional digestive diseases or functional gastrointestinal diseases. So those which in which the GI tract looks kind of normal, okay, when you examine it, but it does not move properly. That is called functional diseases. And they are the most common most common problems that we all suffer from in terms of constipation, diarrhea. Okay, they all come from, they all are functional digestive diseases, which means that there is nothing wrong with the structure, or there is no major anomaly in your intestine. Okay, anatomically nothing is wrong, but functional wise, some lack of mobility or over mobility, over secretion, lack of secretion. Okay, these are the functional diseases. The GI tract has no issues structurally. Anatomically speaking, it looks completely healthy, but the way how it is supposed to function, it's not functioning accordingly. So that is what we call as functional gastrointestinal diseases. They are the most common problems affecting the GI tract, including your colon and rectum. Okay, constipation, IBS, irritable bowel syndrome, nausea, gas, bloating, diarrhea, they are common examples. At some point of our life, we all have undergone these symptoms. Okay, there is nothing wrong structurally, but these functional hiccups do tend to happen. You have some indigestion, you have some food sensitivity, some food intolerances. This is how your GI tract is going to react. So that's a functional issue, and it's acute. In 1 or 2 days, you will get over it. So many factors which can upset your GI tract and its motility, the ability to keep moving. That is your peristalsis movement, the wave-like movement that propels the food, digested or partially digested food, forwards. Okay, that is because of the peristalsis movement. So eating a diet that is low in fiber, not having enough amount of exercise, traveling, or other changes in routine. Okay, eating large amount of dairy products, stress, resisting the urge to have a bowel movement, even if you're feeling like you have to go to the bathroom to defecate, but you avoid it. Either maybe you're traveling, or it was not the time was not correct time where you could have defecated, or maybe because you have painful hemorrhoids, and because of this painful hemorrhoids, you try to avoid defecating, or you try to avoid your bowel movements. Okay, overusing diarrheal medications, which leads to constipation. Okay, taking antacids frequently, which contains calcium and aluminum, taking certain medications, specifically antidepressants, iron medication, iron supplements. Okay, very strong pain medicines like narcotics. Morphine comes under this category. Morphine is an example of a narcotic painkiller. Okay, and in the physiological stage of pregnancy as well, because the growing fetus, the uterus is pushing up your intestine. In women, when the uterus is growing along with the fetus, it is pushing the entire internal organs, abdominal organs, including your GI tract, upwards. So the GI tract is getting squeezed between your growing uterus and your diaphragm. Okay, so that also reduces your motility, and constipation is very common among pregnant women as well. Okay, so these are the factors that could lead to some functional disorders, which are usually acute uh, in occurrence. Then we have the structural GI diseases, structural gastrointestinal diseases. So these are when you do your diagnosis, usually when you go for a barium x-ray, they feed you a barium containing drink. Okay, you have to swallow it, and then your x-ray is taken. So barium, creates opacities for x-ray rays, so x-ray rays cannot pass through barium. So exactly where there is an obstruction, or where there is a abnormal contraction, any other structural imbalances, if it is found, barium can show you in the x-ray. That is one way. Then you can do colonoscopy. Okay, a fiber optic camera, tube with a camera is inserted through your anus, through the rectum, and through the sigmoid column as well. It goes inside, and inside of your intestines are visible. Okay, so that is colonoscopy. Endoscopy could also show you certain issues as well. Okay, so these are the structural gastrointestinal diseases can be diagnosed through these procedures: barium study, barium x-ray, barium swallow x-ray. Okay, colonoscopy, sigmoidoscopy, endoscopy. Okay, these are the uh, diagnostic test which we use usually. Okay, and also ultrasonography will show you certain uh, anomalies as well. Okay, so structural GI diseases are those in which your bowel means your intestine. Okay, it looks abnormal upon examination, and on top of that, it does not work properly as well. Okay, so if structural is a combination of anatomical abnormality, along with that some functional abnormality. Sometimes the structural abnormality needs to be removed surgically. If that's the only resort left with you, you have to undergo surgery. Common examples are strictures. Strictures means narrowing. Okay, strictures means narrowing of your intestine. You do not have enough space. The food does not have enough space to move around. Okay, there is a narrowing of the intestine, because of which very slow movement of food is seen. Stenosis as well, that is also narrowing. Okay, hemorrhoids, diverticular disease, colon polyps, colon cancer, IBS. Okay, we will discuss hemorrhoids also, it's coming up. Okay, so these are the most common forms of structural GI diseases. So far, is it clear to you all what is the difference between functional GI diseases and structural? Functional diseases are usually your symptoms. GI means gastrointestinal. Gastrointestinal. Stenosis means narrowing. Stenosis means narrowing. Stricture also means narrowing, okay, because it does not allow the passage. Stenosis is also, yeah, stenosis is also narrowing. Stenosis can take place in your blood vessels as well, but stricture usually takes place in a canal or tube. Okay, it takes place in a anatomical structure. So coming to constipation, it is a functional problem. Constipation is usually a symptom to some other disease conditions. Okay, so functional problem. It makes it hard for you to have a bowel movement or pass stools. Stools are infrequent, less than 3 times in a week, or it is incomplete. Even if you are passing your bowel movements on a daily basis, you feel incompleteness. You feel that you have not completely passed all the stool. Okay, and it is usually related to not having enough fiber in your diet. Roughage means fiber. Okay, roughage means fiber. Okay, or if you have any disruption in your regular routine, you have a routine of having breakfast by 8, lunch by 1, dinner by 7. That is a routine for you on a daily basis. If at all, so because of your traveling or any stress or something abruptly happened and there is a disruption in your daily routine timings of having food, okay, that could also lead to constipation. It causes you to strain during the bowel movement. When you sit on the commode, you have to push a lot to defecate, okay? And it leads to small and hard stools. You can see here type 1 and type 2, okay? These are how a constipation stools looks like, okay? Separate hard lumps like nuts. It's very small, difficult to pass. It indicates constipation. And lumpy, any lumpy hard stools is constipation, okay? The opposite of it is diarrhea. You can treat your constipation at home by increasing your fiber and water intake in your diet, exercise regularly, and the intensity of the exercise also can be increased. For example, adding weights in your training. Okay, resistance training. These all increases the intensity of your exercise. Moving your bowels when you have the urge. Don't worry about the timing and everything. Whenever you have an urge, immediately find a bathroom and defecate. Okay, don't try to resist the urge of defecation. Okay, if these treatment methods don't work, laxatives can be used, but only under prescription. Okay, so these are the treatment options available for constipation. Coming to IBS, irritable bowel syndrome, you can see here abnormal contractions can take place, and this could be painful as well. Okay, uh, peristalsis moment means a continuous wave should take place. One part of the bowel is contracted, the other part is relaxed. The other part will contract, the next part will relax. So because of this continuous contraction and relaxation in peristalsis moment, the food is propelled forward. Okay, that's how it gets digested, it gets broken down. Okay, but in IBS, abnormal contractions take place. Okay, even if this area is supposed to relax right now, it will stay in the contracted form. It could be painful as well. For some people, this could be painful as well. So this is IBS, irritable bowel syndrome. Abnormal contractions take place at any place because the muscular layer, again, the peristalsis movement is not in your hand. It is an involuntary movement. So these abnormal contractions are also involuntary. You do not have any control over it. Okay, so this is IBS. Also called as spastic colon. Spastic means spasm. Spasms are involuntary contractions that takes place in your body, which is not under your control. Okay, irritable colon, IBS, or nervous stomach. These are the other names used for IBS. Okay, and it's a functional condition where your intestinal muscles contract more, less, or either it contracts more than often, or it does not contract enough. Okay, and not there is a normal way of contraction. One part of the colon is contracting, the other part has to relax. Only then the food can move forward. Okay, otherwise the food will get stuck there. So this is what IBS is, and certain foods, medications, and emotional stress. Okay, these are the factors that can trigger your IBS. It includes abdominal pain, cramps, access of gas, bloating, change in the bowel habits, harder, looser, or more urgent stools than normal. You will have too much of constipation issues or diarrheal issues. Constipation or diarrhea both can take place. For example, if if your intestine is contracting more, okay, if the intestine if you have an IBS in which your colon, large intestine, is contracting more, what will you have? Will you have constipation or diarrhea? Yeah, when the contractions is more than normal, you will have diarrhea. If the contractions are less than normal, what will you have? Constipation. So it depends upon what is the contraction that a patient with IBS is having, either more than normal or less than normal. Based on that, symptoms will change. Okay. Based on usually symptomatic, when the patient is talking about the symptoms, okay, the gastroenterologist will come to know it is an IBS even without any invasive test. Okay. Because if the patient is suffering from a lot of abdominal pain and cramps, in some cases being lactose intolerant and still having dairy products, okay, that would also trigger IBS. IBS has certain triggers. Specific kind of food can cause this abdominal contraction. If you are stressed, it can lead to abdominal contractions. Okay, so there are specific triggers, and the physician will ask you about these specific triggers, and if they are seeing the same pattern of symptoms and your triggers, it is concluded that you will have IBS. So that is a role of the physician, the gastroenterologist, to identify if it is an IBS or not. Okay. You can treat IBS at home by avoiding excessive caffeine, increasing fiber in your diet. Keep a food diary to monitor what specific food trigger you have after having which kind of food you notice this abdominal pain, bloating, etc. Okay, so these are your triggers. Minimizing stress, learning different ways to cope with stress. Okay, stress management has to be done. Taking medications as prescribed by your healthcare provider. Avoid dehydration, be well hydrated, get high quality rest, sleep. Along with that, physical activity. Okay, at least half an hour of physical activity. H. pylori infection usually takes place in your stomach. IBS is something that happens in your large intestine. Helicobacter pylori is what leads to peptic ulcer. H. pylori infection leads to peptic ulcer. That happens usually in your stomach. Okay. IBS is what happens in your large intestine, colon. Symptoms would be quite similar, but for H. pylori, there is a definitive test. You will have to have a carbon isotope. Okay, there is a definitive breath test done for H. pylori. Okay. Next is hemorrhoids. So what are hemorrhoids? Hemorrhoids are dilated veins in your anal canal. Okay. At the end of, from where your defecation happens, at the end of your digestive tract, where your anus is, in the anal canal. Okay, this is a structural disease. Okay, so they are caused by chronic excess pressure by straining during bowel movement. So people who have suffered from constipation from a very long time, okay, usually they will have hemorrhoids, either internal or external hemorrhoids. Okay, because there was and also it can happen nowadays. It is very common. Reason being, taking your mobile phones, smartphones in the bathroom, and sitting in that position for a pretty long time with your mobile phones. Okay, that could also lead to hemorrhoids. Okay, because you are when you are sitting on the commode, specifically European commodes, for a pretty long time, you are stressing your perineal region. Okay, your anal region is under stress in that position. Okay, so that it is having a lot of strain as well. So that could also lead to hemorrhoids. So there are two types of hemorrhoids: internal and external. Internal hemorrhoids happens when it is not visible from outside. Okay, because within the rectal anal canal, there are blood vessels. Okay, inside your anal opening. When they fall down into the anus, because they are bulging out and they're falling down, because see, when you're sitting on the commode for a long time, because of gravity, a lot of blood is getting collected in the veins. Okay, and the gravity is not allowing it to be pumped up. Okay, gravity works in opposite direction, so the blood is getting filled up in the veins and it is bulging. Okay, on a regular basis, when this bulge happens for a longer period of time, the longer you spend in the bathroom, the longer period of time this bulge of vessels are happening. Over a period of time, your blood vessels in this area will lose their elasticity and they will prolapse into your anus. And when they prolapse into the anus, sometimes when you're passing the stool again, which is constipated stool, that can cause harm. It can burst open the these blood vessels as well. So hard stool is passing. Just imagine a situation when a hard stools feces is being passed from the anal canal. The bulging out blood vessels are in a prolapsed state. Okay, and they do not, these blood vessels have lost their elasticity. Okay, so it is very easy for the hard stools to cause harm here and lead to burst opening the blood vessels or the bulged out blood vessels, and that would lead to bleeding. Okay, blood in the stool, that if it is fresh blood in the stool, that could lead to, that could be the could be hemorrhoids. Blood, if the blood clots are present, that could be some tapeworm infection or peptic ulcer. Okay, which kind of blood you are finding in the stools are what we use usually for diagnosis. If it is fresh blood, it means some recently somewhere near the anal canal or in the colon some harm has been found. Okay, it could be an ulcer or a fistula or a hemorrhoid bleeding, anything, if it is fresh blood. If it is a blood clot, means somewhere inside the stomach or in the small intestine some issues are going on. Okay, so in internal hemorrhoids, this is what happens. Ultimately, internal hemorrhoids can fall down enough to prolapse and stick out of the anus. And when the hard feces is passing through the anal canal, it can burst open and lead to bleeding. So treatment includes, you have to improve your bowel habits. Okay, make sure that you avoid constipation, because constipation will lead to bleeding. Not straining when you are during your bowel moments. Do not push your feces out. Okay, if you are having constipation, definitely you will have to push it out. But otherwise, if you are well hydrated, you will feel it very easy to defecate. Okay, your healthcare provider can also use ligating bands to eliminate the blood vessel. That is surgically, it's not invasive, it's a small procedure. Okay, in which the blood vessel will be pushed back into the anal canal to eliminate further bleeding. And in some cases, if too much bleeding is there, too much prolapse of the blood vessels are seen, surgically you will have to remove it. And usually for persistent hemorrhoids, okay, you have to use surgical methods. So external hemorrhoids means it's not happening in the anal canal, just outside the anal opening somewhere near. Okay, veins that are that lie just under the skin on the outside of the anus. Okay, not inside. Sometimes after straining, the external hemorrhoid veins can also burst open, and it can form blood clots under the skin as well. Sometimes this can, rarely this blood clots or the bleeding comes out. Okay, because the skin there is still intact, but you can find blood clots in that area. So this is what we call as pile. Okay, so treatment, it includes removing the clot or the vein using under local anesthesia. Okay, and also removing the hemorrhoid itself. It's a small surgery, not an invasive surgery. Okay, because the blood clots that have took place, it is just under your skin, so it's not an invasive surgery. Okay, so this is what in other terms it is called as piles. Okay, which is visible from the outside. It is not happening inside the anal canal. If it is happening inside the anal canal, it is internal hemorrhoids. If it is external, not inside the anus, around the area of the anus, okay, outside, that is called piles, external hemorrhoid. Okay, is the difference clear to all, internal and external hemorrhoids? External hemorrhoids usually will not bleed. Internal hemorrhoids can bleed. Okay, because the hard stool, constipated stool, is not affecting the external hemorrhoid. Only your strain, the stress that you give to push out the uh, feces, that is affecting the external hemorrhoid. So it leads to blood clots. Okay, it will not bleed out. It will bleed, but it will be trapped. The blood will be trapped under the skin. Okay. Yeah, as per this article, external hemorrhoids are called piles. Internal hemorrhoids are referred to as hemorrhoids, internal hemorrhoids. Then we have anal fissures. So these are small cracks, okay, that can happen in the anal opening, splits or cracks that happens in the lining of the anus, and it exposes the underlying muscles, okay, that control the passage of stools. So what happens is that this, like again, because of your stressing a lot during your bowel movement, okay, that could also lead to this, uh, because the muscles become weak there because of excessive stress and sitting on the commode for a pretty long time. It will loosen up your perineal muscle. Okay, so the anal canal, within the anal canal, splits or cracks can happen. Okay, and it can bleed as well. When the splits and cracks are happening, it can lead to fresh bleeding as well. And when the feces is passing through this, it could lead to burning, intense pain. Okay, soon after you have completed your bowel movements, you will have this intense pain, burning sensation. Okay, the most common cause of this is very hard or watery stools. Too much of watery stool, or when you undergo diarrhea, you are suffering from diarrhea for many days. Okay, yeah, every hour, every 2 hours, you're going and using the bathroom, and every few hours, this anal canal is getting exposed to watery stool. Okay, the anal lining will become very doused in water. Okay, and easily it can crack as well. Okay, for example, when you, if you must have noticed, if you swim for an hour or so, when you notice your fingers, what happens at the tip of your fingers, the skin becomes extremely soft. Okay, it is very easy to burst open or bruise or cut your skin when it is wet as compared to it is dry. Okay, so that's the reason why when you are suffering from diarrhea for a pretty long time, and if it is left untreated, it could lead to anal fissures. So treatment, pain medication is given, dietary fiber to reduce the occurrence of large bulky stool. And if the patient is having diarrhea, diarrhea has to be cured. Sitz bath, okay, that is, you have to use a wide tub here. Wide tub, small tub, but wide tub is used. Lukewarm water is put into it. Some iodine component will also be put for disinfection, so for antiseptic purpose. Okay, and the person is supposed to sit in this tub. Okay, so the lukewarm water or hot water along with this antiseptic will provide some relief to the anal fissure. Okay, and if this does not relieve your pain, you will have to undergo surgery to repair the crack or repair the split that has took place. Okay, then we have perianal abscesses, commonly associated with this anal fissure as well. Okay, because what happens is that, mm, it's a structural disease when tiny anal glands open in the inside of your anus, or it becomes blocked. Okay, sometimes because of an anal fissure, okay, it gets blocked because of your bacteria or because of the stool that you're passing. That could lead to pus formation. Okay, and it could lead to infection. Your own stool can lead to infection if it is getting trapped or blocked in the anal fissure. Okay, so anal fissures can lead to a abscess, perianal abscess as well. So and when the pus formation happens, that's when we call it as perianal abscess. Abscess means pus. Okay, so the treatment includes draining the abscess initially under local anesthesia and then using antiseptics to prevent further infection. Okay, you have to visit the healthcare facility. They will via a small surgical opening or just through syringes, they will drain out the abscess. They will remove the pus completely, provide antiseptic, topical application, antiseptics can be applied here. Okay, so that further infections will not spread. Then we have anal fistula. Fistula is an abnormal opening, an abnormal canal that has become evident. Yeah, it is rated. Your anal canal has a lot of glands as well. Okay, that can also get blocked and lead to abscess. Another situation is if anal fissures take place. A small crack happens in the anal area, and imagine a situation in which the stool is getting obstructed there in the anal in that crack or split. That could lead to infection and pus formation. Okay, so either the anal gland can get blocked because of any uh, bacteria or any other blockages. It could lead to abscess formation. Okay, so this is an anal fistula. You can see here the anal canal, and an abnormal opening, internal opening took place on the sides of the anal canal, and it is causing another it is causing an abscess here, and through abscess another fistula has been formed. So fistula is an abnormal opening. This opening is not supposed to be there anatomically, but it happened. Okay. Again, because of weak muscles present in the perineal region is one of the reasons why. So annular fistula, again, it's a structural disease. Okay, it often follows the drainage of an abscess. It is an abnormal tube-like passageway. Any abnormal tube-like passageway is called fistula. Okay, from the anal canal to a hole in the skin or near the opening of the anus. So it can happen in any direction. Okay, fistulas can happen in any direction. Body waste which is traveling through your anal canal can get trapped into that fistula. Okay, and they will get stuck into this abnormal opening. It will cause itching, irritation, and further infection. Fistulas can also cause drainage, pus drainage, blood drainage. It could lead to pain as well, and they will not heal by themselves because something foreign has got trapped inside the abnormal opening. You will have to go for a medical help here. Usually surgery is required to completely remove what all things have got trapped in the fistula, and then close off the fistula. The abnormal opening that has took place, it has to be completely closed off surgically. Okay, they don't heal by themselves. Because the perineal muscles are weakened over time. Okay, and it is very difficult to regain the strength of a weakened perineal muscle. Then we have diverticular disease. Diverticular disease means outpouching that takes place. Okay, diverticulosis. So diverticulosis is the presence of a small outpouching, which we call as diverticula. You can see here. The left side is a normal colon, large intestine. In the descending colon, you can see a lot of outpouches that are protruding outside. Okay, in the muscular wall of your large intestine, and specifically in the weakened areas of the bowel, a lot of diverticula can be found where muscle tone has been weakened over time. Okay, so they usually appear in your sigmoid colon because a sigmoid colon, you can see here when you sit on a commode, more than on descending colon. On sigmoid colon is the one that bears majority of the weight of your abdomen. Okay, when you pressurize a lot or stress a lot to defecate, okay, sigmoid colon is the one that is going to get or absorb a lot of stress and pressure. So the muscular layer in the sigmoid colon can become weakened over time, and that leads to diverticula. Okay, So diverticulosis can sometimes develop or progress into diverticulitis. Okay, diverticulosis means presence of this outpouching. But when when these outpouches get inflamed, we call it as diverticulitis. Okay, itis at the end, if you find itis, itis, it means inflammation of that region. Treatment of diverticulitis includes treating the constipation and sometimes antibiotic if it is really severe. Surgery is needed as a last resort. Then we have colon polyps and cancer. Yeah, it is an extra growth, but it is empty from inside. Outpouching means it's an extra growth. Muscle layer is growing outwards, but it is empty from inside. So whatever stool or feces is passing through the canal, it can get stuck into these pouches, and that could lead to irritation, inflammation. Colon polyps and cancer. So colon polyps are usually the first stage. Usually the colon cancer will always start with polyps. Polyps is benign. Okay, it's not cancerous. You remove the polyps from the colon, you will not get cancer. Okay, cancer can be prevented. So early detection of polyps can be done using a barium swallow, sigmoidoscopy, colonoscopy, using all these techniques. Early detection of polyps can be done. As soon as you find the polyps in your colon, it can be surgically removed. Okay, screening test, it is possible to prevent, detect, and treat the disease long before it becomes cancerous or long before the symptoms appear. Polyps can be removed. Almost all colorectal cancers, so the cancers that takes place in your rectum and your colon. Colon means large intestine. Okay, so all these colorectal cancers begin as colon polyps. Polyps is benign. Okay, it is a tumor. It's just an outgrowth. You can see here in stage 0, an outgrowth is happening into the lumen. Okay, into the lumen, into the canal of the large intestine. So this outgrowth, it is non-cancerous. You remove it surgically, you can prevent cancer, colon cancer. Okay. Cancer develops when these polyps grow and abnormal cells develop, and it starts to invade the surrounding tissue. You can see here, when this polyps is not removed at the right time, it keeps on growing. Okay, and after that it forms abnormal cells. You can see here the pink colored cells were normal. Okay, yellow colored is the abnormal proliferation and differentiation of the cells. These are not normal cells. Okay, so abnormal growth of cells are seen, and this abnormal cells can invade other tissues. Once if they get into your lymphatic system, if this abnormal cells get into the blood circulation and lymphatic system, through this blood circulation, these cells can go and deposit anywhere in the body. Through the lymphatic circulation as well, these cancerous cells, abnormal cells, can grow and deposit anywhere in your body. And from there, cancer begins. From one part to another part, the cancer has spread, we say, right? So this is how the cancer spreads. If the invasion has involved, okay, circulatory system of your body is involved in this abnormal invasion, means now the cancer can spread anywhere in the body. Okay, so removal of polyps can prevent the development of colorectal cancers. Is it clear to all? Next, we have colitis. Colitis means inflammation of the large intestine. Okay, there are different types of colitis, like infectious, because of an infection, bacterial, viral. Okay, it and external invaders have come in and caused infection. Ulcerative colitis, ulcers, intestinal ulcers have happened, and ulcers can also lead to inflammation. Crohn's disease, Crohn's disease also, different part of your intestine, inflammation is happening, and that could lead to colitis. Ischemic colitis, which means there are certain obstructions in the blood supply to your colon. Somewhere blood supply is obstructed, and the certain parts certain areas of your intestine is not getting adequate blood supply. That could lead to inflammation. Okay. Radiation colitis, cancer patients who are receiving radiation therapy. Okay, radiation therapy can also lead to inflammation. Specifically, colon cancer, rectal cancer patients. Polyps, it is genetic. Okay, if you have any family member who had a history of colorectal cancer, if you are related by blood, it's a blood relation like brother, sister, niece, nephew, father, mother, parents, grandparents, okay, like that. Any of your blood relations have suffered from colon cancer or colorectal cancer, or they had a history of colon polyps, you also have to get tested for it. Okay. Anyone, and also anyone who has crossed the age of 40, who is above 45 or 40, it's better to get a colonoscopy done. Specifically males. Specifically males, chronic smokers, get a colonoscopy done after the age of 40. Cervical cancer is not the part of this discussion at all. It's a female reproductive cancer. Cervix is present just above your vagina in females. When cancer happens, that is cervical cancer. Colitis can cause diarrhea, bleeding, abnormal cramps, urgency, okay, and frequency also will increase. You always feel like you want to defecate. There is an incompleteness of defecation. You want to defecate more, okay, and there is an immediate need to empty your bowels. Treatment, it depends on the diagnosis, which is made by colonoscopy and biopsy. How far has the colitis spread? Okay, which part of the colon has the colitis spread? Okay, usually NSAIDs, that is non-steroid anti-inflammatory drugs, are given. Any form of anti-inflammatory drugs are given medically to subside the inflammation. PCOD, PCOS is female reproductive system diseases. It's not a GI disease. Crohn's disease. So it's a chronic disease. Okay, it happens. It's usually genetic. Crohn's disease is also genetic, in which in colitis, if you notice, in colitis can happen in any of the one portion of the intestine. It could be either your ascending intestine. This is the ascending intestine. This is the transverse colon. This is the descending colon. This is a sigmoid colon. This is the rectum. And finally, you have the anus. This is how your large intestine is categorized. Okay. So in colitis, either the entire ascending colon is inflamed, or the entire transverse colon, or the entire descending colon, or the sigmoid colon, like that. It is inflamed. But in Crohn's disease, it's not like that. In Crohn's disease, anywhere at the very same moment, anywhere in your intestine, inflammations can take place. You can see here an example of Crohn's disease. It is a patchy inflammation. Crohn's disease is a patchy inflammation. Some patches of inflammation is seen in the small intestine. Some patches are found in your large intestine. Okay, so that is a patchy inflammation. It's also a form of colitis, but inflammation happens in patches here and there. Okay. So Crohn's disease is a chronic, long-lasting disease that is caused by inflammation and irritation of your digestive tract. Symptoms are diarrhea, cramping, abdominal pain, weight loss. Okay, because of this constant pain and cramping that happens spontaneously, you lose your appetite. That's how weight loss happens. And also the areas which are inflamed in the small intestine, in the large intestine, the areas that are inflamed, they will not function properly. So the malabsorption of nutrients will be seen, because of which weight loss happens. Okay. Doctors treat Crohn's disease with medicines, rest, bowel rest, that is, the patient may be put on fluid diet, liquid diet, off, on and off again. Okay, surgery as well. The goal of the treatment here is to decrease your inflammation in the intestine as much as possible, to prevent flare-ups as much as possible. Okay, you will be put on anti-inflammatory drugs so that there is no flare-up. Flare-up means immediately you suffer from chronic pain. There is a immediately few days you will suffer from chronic inflammation. Okay, because something triggered, either stress or certain specific food triggered that inflammation. To keep you in remission, always keeping the inflammation down, that is what is the goal of treatment here. Dietary management done for Crohn's diseases, you provide them high calorie diet, lactose free diet, or low fat diet. High calorie diet, why? Because weight loss has to be tackled. Okay, lactose free diet to prevent sensitivity. Majority of the population worldwide is already lactose intolerant, so why to add more? Okay, so lactose free diet and low fat diet is given. Why low fat diet? Already the intestine, small intestine and large intestine, is compromised in function. So giving more fat will put more stress on the intestine. To prevent that, low fat diet has to be given. High calorie means you can give more carbohydrates, less fat, and no lactose. Then we have celiac disease, the only disease condition in which we know that going gluten free actually helps. Okay, this is the only way. Going gluten free is the only way through which you can put yourself in remission when you have been diagnosed with celiac disease. Okay, nobody else, the gluten free diet will help usually. Okay, so in celiac disease, it is a chronic digestive disorder or immune disorder in which your small intestine villi is damaged, specifically the villi. You can see here the normal villi, it is long finger like projections. Okay, these are supposed to absorb the nutrients. These villi is supposed to absorb the nutrients, but when you suffer from celiac disease, you can see it is shortened, it is flatter. Okay, it's not as long and protruding outside, it is shorter. That is what happens in celiac disease. The intestinal villi have been atrophied. Atrophied means they have decreased in their size and length, and their function is also decreased. Okay, and anything that has gluten can trigger it. Gluten means what? Take any flour, okay, pulse flour or cereal flour, millet flour, any flour, take any flour, atta, okay, add water into it. If it is getting sticky, okay, if the flour gets very sticky, mushy, it means it has gluten. If you add water into any flour and it does not get sticky, okay, it does not get gooey, sticky, it does not have gluten. So gluten is that protein that when it is activated with water, it gets sticky. For example, wheat, maida, okay, rye, okay, they all have gluten. Rice does not have gluten. Millets like ragi, jowar, they do not have gluten. Okay. So this disease can cause long-lasting digestive problems and keep your body from getting all the nutrients it requires, because already that the nutrients absorption is compromised because of short villi. Okay. So to treat celiac disease, you will have to follow a gluten-free diet. Okay. When you go for gluten-free diet, you can make sure that whatever villi is present in your intestine, which is normal, they can do a better function at absorbing nutrients. Okay. Yeah, it is a genetic condition. It can be passed from generation to generation, because it is basically your anatomy, the autoimmune disorders or anatomy of what you have received hereditary. Gluten-free diet can prevent the triggers of celiac disease. Okay, gluten-free diet will not cause the disease; it's the solution to the disease. Then lactose intolerant. Having anything that has lactose causes bloating, excessive gas. You feel full even with small amount of food. You will feel full. You will have lower abdominal pain. diarrhea, nausea, vomiting, constipation. These can happen when you are lactose intolerant and you have ingested that something that has lactose. Okay. There are different forms of diagnosis that is done for celiac disease. Usually, the doctor will ask you to be on a gluten-free diet for a few days, and if the symptoms have improved, it means you are suffering from celiac disease. There are other ways also, like colonoscopy, sigmoidoscopy. Okay, endoscopy can be done to visualize what kind of villi is there in your system. Biopsy can be done. Okay, there are a lot many ways in which diagnosis can be made. If the person is allergic to gluten, as soon as they have gluten-based food, they will show allergic reaction. Okay. Otherwise, the person is first of all not allergic to gluten at all. If you're allergic to something, your body will respond to that. It will show allergic reaction. It will show hypersensitivity reaction. So lactose intolerance, if you have lactose intolerance, you will have digestive symptoms like bloating, diarrhea, gas after you consume food or any drink that contains lactose. Okay, it can affect your health also because whatever food contains lactose is also rich in calcium and vitamin D. For example, all your dairy products, milk products, and dairy products. Okay, so symptoms are bloating, diarrhea, gas, nausea, pain in your abdomen. But changing your diet, or if you limit the food that contains lactose, your condition can improve. Not everyone requires a situation in which you have to completely avoid lactose. If even if you limit your lactose intake. Okay, for example, even I am lactose intolerant, but on a daily basis I will not have lactose based products, but once in a while, once in a month, or once in a week, if I'm having some milkshake or something, it does not cause me any problem, any issues. Okay, but if I'm drinking milk based products or cheese on a daily basis, that could give me symptoms of acne, okay, other digestive issues. So I just have to, for personally, I have to limit lactose in my food. I don't have to completely avoid it. Completely avoiding it is also a choice. It's a healthy choice, but limiting is also something that allows you to try varieties. Okay, you don't have to shut down specific kind of food completely. Okay, so based on the category of lactose intolerance you have, it is mild or severe. Either you have to completely shut down. For example, children who are born with phenylketonuria, they will not have lactose based food at all. They have to completely avoid it. They are not supposed to have it. Galactosemia is another inborn errors of metabolism. They will also cannot tolerate. They will not at all be able to tolerate lactose in the diet. Okay, so for them, complete avoidance is required. For others, based on what kind of symptoms, severity of the symptoms you have, you can either limit it or avoid it. Okay. Using lactase products can help some people manage their symptoms. For example, you're going to be in a party or you're going to go out, have dinner outside in a reception. Okay, you have to be part of a cultural fest or food fest in which lactose based food is going to be served. Okay, so what you can have a lactase tablet. Lactase is an enzyme that is supposed to break down lactose. Just before you have lactose based food, just before it, first you have to eat this enzyme, okay, this enzyme tablet of lactase, and then you can continue having whatever food that has cheese or milk in it. Okay, so it will not give you any triggers. So that's all for today's session on GI disorders.